Hello, you guys. It's no edition of A Lot of Help. I'm James Lott Jr., your host, certified life coach, and human who goes to the dentist. I'm so happy to have somebody on here who's doing some amazing stuff here in the Santa Monica area, which is part of Los Angeles. We're not from here. Creator of Facelift Dentistry. There's the cosmetic stuff, and he's actually has a unique dental office and practice he's putting in right now because of the COVID-19 virus and the safer at home and all these different practices. So I'm very happy to have him on here, Dr. Sam Muslin. Hi, Dr. Sam.
Hi, James. Thank you very much.
It's my pleasure to have you on here. And first, I'd like to ask everybody, of course, how are you doing during this whole thing?
I'm doing well. It's interesting to take the opportunity to where you're breaking from your normal routine of so many years. And so you're having a chance to get things done that you might not get done and make adjustments to your practice, such as we're going to have to practice differently. We need disposable clothing and 95 masks, got to train the staff. We're doing all of that right now.
All right, so let's just go right into that, because what I'm reading is from, I mean, you covered everything from like the doors being, hands-free to, certain air conditioning systems to how many patients actually come in the, I want to hear all that stuff. So first of all, how long have you been in practice?
43 years.
You're like a day over 42. I don't know what's going on there. That's crazy. You were a child prodigy. You're a child prodigy. What's going on there, doctor?
I don't know. Again, I don't have an answer for it, but I'm enjoying what I'm doing. And the practice has just evolved to a level of dentistry where it's just beyond what anyone would really expect dentistry could even do.
So, okay, so you're in Santa Monica, and which is a great area. I'm in Inglewood. It's not far from you. I love Santa Monica.
Yeah.
And so, okay, so the virus news starts coming around. It was before the shutdown, before the safer at home, and then all of a sudden that shelter at home started coming to place. So did you go into like mode right then and there? Okay, we got to start adapting. How'd that start for you?
Well, you have to adapt. My office structure, we covered a little earlier, the design of it is unique because the 5 treatment rooms are all designed like an operating room. And so they have power doors that shut tightly, and each patient is being treated in an isolated private room that has air conditioning, air going in, and air is being drawn out of the room the whole time. And so it's the ultimate level of safety, particularly in a dental office, because if someone's walking in the hallway, you're not exposed to anything if they were to sneeze, and your mouth is wide open in a private treatment room. So you're saved from them and they're saved from you, so to speak. So it's a beautifully futuristic office design. There's no doorknobs, so you just touch a plate with your elbow or your foot. You can open the door and get in if you want to. There's flat screen TVs on the ceiling, which patients have enjoyed, something to look at and while they're being worked on. And so it's just been a very, very good design and a safe design for my patients.
I'm a former nurse, so when I read that, it reminded me of operating rooms where you don't really touch anything, obviously, because you can't touch anything. Bodies are opened up and you're about to go in. So I heard that, I was like, oh, this sounds like an operating room. It sounds like very much like a hospital type setting where you don't really touch stuff with your hands. You don't just like touch stuff. And you bring up a good point, because people ask me, well, your mouth is open, so that makes you more susceptible to all kinds of stuff going there, correct?
It does. That makes having the private rooms and tight doors and rapid air exchange a vital component of your safety. And my practice is such that I don't do a lot of surgeries anymore or the implants anymore. If someone needs that, I have specialists that I refer patients to. But the key thing to my dental practice is not only is the office a futuristic type approach, but the dentistry is futuristic. In other words, there's some very unique benefits from this type of care.
Okay, so let's first go into just the design. I'm sure you had to research kind of like what's the best ways, and you kind of, was it through trial and error? You're kind of like, okay, I'm gonna have this going on. I mean, I'm sure. I mean, making your whole office kind of state of the art was very interesting.
Well, the earthquake destroyed the building, and
Oh.
built the building back, and wanted me to come back, and so My wife is a pediatric intensive care nurse,
Okay.
and she's taking design at UCLA, and she's a
What?
national certified medical designer.
Wow.
My office was her first project, and she could take the plans to the architects teaching the course. What do you think of this? What do you think of that? But the idea of the power glass doors and isolating rooms and all of that, office has been this way for many years. I've been protecting my patients pretty much the whole way, whether it's flus or colds or whatever. It just happens to be this new virus that's come along has made this design even more vital.
Yeah, I was gonna say. This is usually flu season anyway. Like when you go into winter, it's flu season anyway. Allergy season comes up in the spring. So I'm sure you're ready for stuff. This makes it ready for stuff like that.
Yeah.
The stuff coming up anyway. So you're like, okay, we're already ahead of the game. Thank God, you're ahead of the game already with your design.
Way ahead. I wouldn't want to have to spend the. If I were a dentist right now rebuilding a dentist, that would make it pretty darn tough.
Yes, I was going to ask you about it, but you just answered my question about it because you were doing it a long time ago. So okay, so when people come in, I want to get the experience going. So you make an appointment for some procedure or whatever at your dentist office, and how does that? So you make the appointment. How when they first show up, what's the procedure? Is like don't you only let in like one person at a time or four people? How does that work?
Well, first of all, I don't treat, let's say, normal patients that just or anything, and I don't treat children any longer. And I started off as a general dentist, and it was just so busy with so many patients. My wife said the kids are growing up without you, and so I had to balance life a little better. And then when it came time to, I was doing this type of reconstruction that was shocking because most people would not realize that their jawline could look much better by only having dentistry, and that realize their facial profile could be improved, or that they could sleep better because their airway would be a little bigger and they could speak their words. We're living decades longer than ever before, and our teeth are wearing down and our jaw lines are shrinking and our airways are getting smaller and there's no room for our tongues. And so things are happening to us that we would never associate with dentistry. But then a sort of a minor miracle occurred about 30 years ago, and that was the word bonding. And then porcelains have been developed. So the thing is, patients can now come into this office, and we'll go into the procedure, which is pretty simple.
Yeah.
They come into this office, they're looking for an overbite correction, and we're told they had to have years of jaw surgery and braces. They don't. Or people with an underbite and their jaw is sticking forward, and their chin looks huge, and they were told their only choice of treatment is jaw surgery and braces. No longer true.
Wow.
And then I have old where their chins are shrinking and the dad's snoring and they're not sleeping as well, or they have headaches. The cause of all of those things are directly related to the position of our chin. And the trouble was, are we going to, with the surgeries and the braces, it's risky, it's time consuming. Well, guess what? Today, no surgery, no braces. Most of the time it's done in a matter of days. None of your healthy teeth are ground down. That is the miracle of the facelift dentistry method.
Wow. That's amazing.
So I've treated like a man from China that got it done. He was 70 years old. He didn't have a single cavity in his mouth. I did a complete mouth reconstruction, built new color to his teeth, length, gave him a better jawline, took about 10, 15 years of aging from his face, and he's sleeping better, and he looks great. And his wife said he is so proud of himself because he looks so much better, and he went to his 50-year high school reunion and made everybody look old.
Yes, I love it.
Very happy about that. I never even gave him a shot. He had a complete bite reconstruction with porcelain built right over his worn down teeth, and he has a whole new life.
I know dentistry is so interesting, so amazing. It is amazing. And I'm glad that there are things that are now replacing the old ways of major this or major that. Because with any kind of, surgery, any kind of thing, there's complications can happen and stuff. So it's kind of, and money, of course. This is good that you actually do stuff through dentistry that fixes problems, like you said, like migraines, headaches, other issues. It's wonderful. Breathing, because breathing's important, folks. Very important.
Well, his wife said he sleeps an hour longer.
Wow.
And most importantly, he wakes up happy.
I like that. I like that. I do. I like that. That's great. Oh my goodness. All right. So they come to you to have an appointment, a specialty appointment. Let's walk through. What's the procedure kind of? You show.
Right. They tell me what they want. Most of the time you can see it, whether they have an overbite or whatever. And a lot of young people are doing this because it's non-invasive. As an example, I had an ER doctor flew in from another state with his teenage daughter, and her braces were taken off, and her teeth are small and her face had collapsed without the braces on, and she just looked. She had the face of an older woman, and so without even giving her a shot, I added a custom-made thin porcelain layer. It's bonded to each one of the teeth. You chew the same, brush the same, floss the same. They are your teeth. And so she has a new jawline, new facial support, thicker lips. She looks dynamite. She has a smile way beyond porcelain veneers. So when they came in, they showed me their problem. And what I did was, with a quick test, I showed the patient what their new shape of their face can look like. And so they hold up a mirror and they're looking at it, and then I'm simulating doing the facelift dentistry method. And you could see this on faceliftdentistry.com.
Okay.
And so it's federally trademarked because the trademark lawyer was, 20 some years ago, was nobody in the world was using these terms. And I was encouraged by a web designer about 25, 30 years ago, where he was telling me that no dentist is doing this. I had to find a way to he said patent it, or he was just really encouraging me, because he only did websites for dentists, and he had them all over the United States. And when I was showing him, handing him my pictures to put on the website, he was stunned. And so the idea that you could have a younger looking chin jawline through dentistry and never have a healthy tooth drilled down is revolutionary, literally.
That is. Wow. Now, your actual practice is you only book what? A couple a day, possibly? I mean, you don't book you're not like a turnstile of just like, everybody come in, go out. I mean, you literally book a few a day, don't you? Appointments a day?
Turnstiles are no fun.
No, not at all.
If you're a dentist and you're trying to see as many patients as you can in a day, you're going to burn yourself out. Maybe that's why I look young. I don't know.
You look great. You look great. So I don't know, whatever you're doing, you're doing good. So yeah. But I've been in dentistries that are, I had a good endodontist that was like a little more like a few patients. But I've been in dentistry that just like, I mean, it's just person after person after person after person. I mean, it's like, my goodness, that'll wear me out.
It's too much, and you're washing your hands. Of course, today now, I don't think dentists can do that, because really this virus, until we get a vaccine or something, this virus is really contagious. And I just read this morning how the reason some people have a much worse effect by this virus than others is what they call the load exposure. How much did you get when you got infected? How much did you take in? Well, the point is in a dental office, we can't do track and field. Of course, running from room to room, washing your hands, change your clothes. You'd have to your mask. You have to have a new mask, and the N95 masks are really expensive, and disposable clothing. The costs of doing that are going to be a lot. So years ago, I quit checking off my hygiene patients. When a patient would come in, they'd get their teeth cleaned and they'd see the dentist. We don't do that any longer. They see me once a year, and I do a comprehensive exam, and I look at everything that I need to look at. and make sure they're good. Of course, if my hygienist sees something on an earlier visit, she'll draw that to my attention, take the x-ray. But basically, I see my patients once a year, and I don't treat kids, as I said. And the bottom line really is this: facelift dentistry evolved because I'd already done everything. I did braces for 20 years, root canals, implants, bone grafts, surgeries, all of that. And as you just work your way through the process and you see how the traditional dentistry approaches things, and it is invasive, cutting jaws. And in essence, I can simplify this for you.
Yes.
Instead of cutting your jaw to fit your teeth, I'm going to change the shapes of your teeth to fit your new jaw position.
Got it.
And I'm going to change the shape. I'm going to establish that position first. So the young girl and her father came in. I showed her, here's your new face. And they're looking at it and they're really impressed. And so then I make a jaw track, which is a snap-on device that fits over the lower teeth that simulates doing facelift dentistry. So my patients walk out with their new face.
Yeah.
First, if they want to. And so a lot of them that fly in from other states like her test literally overnight, and they wake up in the morning for the first time, they slept better and they don't have a headache or whatever their ailment might be, and they're very excited to start. So I need just a couple, 3 hours to get all the impressions and set this up on an articulator. They go home for 3 weeks and I design all of the porcelain and make the new bite, and they come back in 3 weeks. And here's the beautiful part about it. None of her teeth were ground down. There's no temporaries. There's no pain. I slide I call them Venlay restorations. I slide them right over your teeth with water. They're a little bit loose, but you get to walk around to 4 different kinds of lighting and now see the new you before they're bonded.
So that's so amazing. I love that. I love that. Very amazing. But it's just very cool that you have a business that you adapted, you let go of some things, you added some stuff, state-of-the-art things, and that it's safe. And I think I agree with you. A lot of my dentist office is closed right now. And I mean, most of them are closed at the moment, except for emergency stuff. But they're closed. Right now, they're not equipped to have the way that, like you said, the way they were going. So it'll be interesting to see when we kind of come back to life, so to speak. It'll be interesting to see how these will adapt from now on. They really can't go the way they've been going. I mean, they just can't, I don't think. And you're already ahead of the game. You're ahead of the game already.
Totally ahead of the game. I have patients that are waiting, that want to fly in from this state or that state, and they haven't met me yet, but they've already made up their mind they're doing this, because when you think about what your other choices are, and I designed the website to where when you go to the website, I have before and after video of lots of patients that graciously gave me permission. I deeply appreciate those people.
Yes. Oh, yes.
You can watch before and after videos of them, because dentists were criticizing me, saying this is impossible. You can't do this. And as a prominent lawyer that I treated recently, who already had 2 big reconstructions done in Beverly Hills that didn't work out so well, and I just did it over for him with a new face and a new jawline, he said, it was impossible. It became improbable, and now it's inevitable. He's a very articulate guy.
I love it. Oh my goodness.
It's inevitable, and he's walking tall. He loves it.
Well, I want to thank you for your, first of all, for your time today, but I also want to thank you for doing this, for having this. And I hope I put this out there to the universe. Maybe other dentist offices will see this, and other places will see this, and they'll see maybe a way to maybe modify how they do things and get an idea from you. This is great. This is great. I mean, I'm so glad that you're able to still service our community through teeth, and so get to do it.
We're going to be teaching this soon.
Good. Oh, good. So folks should go to faceliftdentistry.com, first of all, to go ahead and just begin there, right?
Well, begin there and take a look at the patients, because there's more than 100, maybe even 130 patients on this site that have their write-up about them. Some of them, the last 5 years, I've been doing before and after video to prove that I didn't Photoshop the pictures, because people say, oh, that you can't do that with dentistry.
Right.
You Photoshop that. I said, all right. So now I video every one of the patients.
Good.
Patients don't sign to let me put them on the website, but these patients that do, I get special dispensation from me. I'll tell you, I treat them well.
Good man. Good man. Facelift Dentistry, Dr. Sam Muslin. Thank you so much, you guys. Go ahead and follow him at faceliftdentistry.com to look at the videos. A lot of help is on all social media platforms. It's on all streaming services. It's on my JLJ YouTube channel. Everyone, please stay safe and sane while you're at home. And if you're in the LA area or all around, contact him if you want some services from him, because he has it set up for you guys to be safe. So we love that. Thank you.